Cerebral Palsy, or CP, by Josie Burke, Kimberly Rodriguez, and Fabiola Pena. In this presentation, we will define cerebral palsy, discuss types of cerebral palsy, and describe treatment for cerebral palsy. What is cerebral palsy? Cerebral refers to the brain, while palsy refers to the loss or impairment of motor function. Cerebral palsy is defined as a group of permanent developmental disorders that impede movement, postural control, and muscle tone that is caused by damage that occurs to the developing brain. It is the most common motor disability in childhood. 17 million people across the globe have CP. 1 in 500 babies is diagnosed with CP. CP is more common among boys than girls, and CP is more common among black children than white children. Hispanic and white children are equally likely to have CP. Some early signs and symptoms are during the early months of life, developmental milestones are not met, like learning to roll over, sit, crawl, walk, and smile. Also, there's a lack of muscle coordination, including the head drooping, feeling stiff, feeling floppy, and the lack of balance. There are many different signs because there are different levels and types of disability. Some common dysfunctions of CP are disturbances of sensation, perception, cognition, communication, and behavior, epilepsy, and secondary musculoskeletal problems. Some causes and risk factors of CP include birth complications, low birth weight, premature birth, infections during pregnancy, medical conditions of the mother, traumatic brain injury, child abuse, and infancy. The types of CP are spastic, which is the most common type in 80% of people with CP. There is increased muscle tone, meaning that their muscles are stiff and their movements are awkward. Dyskinesia, where movements are uncontrollable, rapid, and jerky. And ataxia, where problems are with balance coordination, they're unsteady when walking, and have a hard time with quick movement and movements that need a lot of control, such as writing. There is also mixed CP. This is a combination of more than one type of CP. Some accompanying issues of CP are chronic daily pain, seizure disorders, delayed growth and development, learning disabilities where approximately 30 to 50% are intellectually impaired, spinal deformities and osteoarthritis, including scoliosis, kyphosis, and lordosis, impaired vision, hearing loss, speech and language disorders, drooling, incontinence, abnormal sensations and perceptions, infections and long-term illnesses, including heart and lung disease and pneumonia, contractures, malnutrition, dental problems, inactivity, and epilepsy. CP is usually diagnosed within the first to second year after birth. It does not progress, but there is a normal life expectancy with treatment. People with CP usually live productive and fulfilling lives. Some medical interventions for CP include physical therapy, occupational therapy, speech and language therapy, surgical interventions, and conventional and alternative medicine. Some goals for occupational therapy treatment are to optimize mobility, maximize independence, enhance social and peer interactions, foster self-care, maximize learning potential, and provide quality of life. An OT plan might include adaptive equipment and assistive technologies, including operating computers, specialized equipment, including evaluation for wheelchairs, fine motor skills like handwriting, hand and eye coordination, and ADLs, including bathing and getting dressed. To summarize, cerebral palsy is a non-progressive, permanent neurological disorder. There is no cure for CP. Treatment can improve the quality of life for those diagnosed with cerebral palsy. People with cerebral palsy can live long, happy lives. Now, I have a question for you. What is the most common type of cerebral palsy? The answer is spastic, which occurs in 80% of people with CP.
Free. created using Powtoon.